Okay, I've got it up. It's streaming. Does that show is live? Let me see. Yeah. It shows live with me open. I see some people starting to talk. Okay,
it looks like we've got it. Okay, right, Nurek. So yeah, I start seeing some chatter. So it looks like we're good. So we're going to go ahead with the intro again. Doc, stand by.
Welcome back. I'm not sure exactly what happened, but we're going to do this show. Anything I say is not meant to diagnose or replace your medical care. Check with your doc before implementing any of the information, and we're going to dive in, answer as many questions as we can in the next half hour. Let's get started.
All right, thanks for your patience with us, folks. And here we go. Leela from YouTube. How does niacin impose circulation and the cardiovascular system? I take the full flush version frequently.
It's a fascinating mechanism. There's several ways that it works. One is a vasodilator. One is deep inside your mitochondria because you need vitamin B3, niacin, to be able to help extract electrons and move them along into this biochemical factory. And that's kind of a precursor. So if you're deficient in that, your mitochondria breaks down, and then everything kind of breaks down, because at the core of so many different chronic illnesses, you have mitochondrial dysfunction. So niacin is one of the key helper molecule or vitamins out there.
Okay, very good. Let's see. Victoria from YouTube, another question about the benefits of methylene blue. What are the side effects? What's the best delivery system? Sublingual or gummies? What do you think, Doc?
No, not gummies. You want to get a pharmaceutical grade. And when I say pharmaceutical grade compared to food grade, pharmaceutical grade is actually cleaner, believe it or not. There's less impurities. And when we're dealing with this dye, this is a synthetic dye. It's one of the first medications. But the thing is, as much as I don't like synthetic things made from petroleum, this is a different thing. It's a pigment, and they stumbled on it, I think by accident initially, and then they found it actually is great for malaria and all these other things. Well, there is a tremendous amount of research over the years of what it can do. It basically helps your mitochondria work better if there's damage in the mitochondria. So it kind of substitutes and bypasses some of the broken parts to allow a full energy to be made. And so I've done extensive videos on this, and it's quite interesting. The people that would really benefit from it are people that have metabolic problems, diseases. Now you're saying, well, that's really rare. No, actually, it's pretty common. If you have, arthritis, inflammation, fatty liver, obesity, insulin resistance, diabetes, like dementia, Parkinson's, those people would benefit greatly from that. And you just want to take small doses in some water, drink it with a straw. Your urine will turn green because it's yellow and blue mixed green. And I would take it, maybe 3 days, and then take a day off, and then take it for 2 days, take a day off. So you can take it not every single day, but it's quite beneficial.
All right, very good. And audience, of course, we're going to stay a little longer to make sure we cover all the homework we need to do. Let's start off with quiz question number 1. There it is, Doc.
What is the most commonly prescribed and abused, usually by patients, drug by dermatologists?
All right, audience, climb on that, as we know you will. Lover of Pretty Things from YouTube. I need to get advice after getting my gallbladder removed. I keep losing hair, and I'm concerned about developing a fatty liver. What should I be doing to address those concerns?
When you remove the gallbladder, you no longer have a controlling factor on the amount of bile that ends up in your small intestine in the right amounts, in the right concentration. So this means that you probably have a problem with one of the fat-soluble vitamins or nutrients. It could be omega-3, it could be vitamin A, D, E, K, because now you're not able to fully extract that from the food. And so it's all dependent on that, the absorption. So what you may benefit greatly, instead of starting to take those nutrients, take some bile salts after you eat, okay? Take a couple and then see if your hair starts doing better, because then you're going to get more bile. Bile does a lot, but one thing is it's really important in some of these fat-soluble nutrients that are crucial for your hair, especially vitamin D.
All right, very good. Why don't we go to our green room? And we've had someone very patient. Lindsay, you are coming to us from Boise, Idaho. And go ahead with your one question for Dr. Berg, please.
Hello, I reached my goal weight and I'm now in maintenance. So my question's about next steps beyond weight loss. What are your thoughts on intentionally trying to cycle my ketone levels to switch between light and deeper ketosis and maybe even periods briefly out of ketosis in order to potentially support my hormones as I move into perimenopause?
I think that's brilliant, because this is how our bodies were developed. And we didn't always just have this consistent ketosis. It kind of came up and down. And when we're dealing with someone that kind of is going into perimenopause, one of the big factors is getting the fuel to the cell. And I think you should try it and see how you do. There's a lot of things that are unknown about this, and so it's worth a shot. When we talk about like going into deep ketosis, you're providing some great fuel for a lot of different things. That shows that if you're in deep ketosis for a long period of time, your insulin can go down to a certain level where you might need more insulin to be able to develop more muscles and things like that. I don't know if that's true or not. So, but I will say this: if you've done it for a long period of time and you've lost weight and you've had some great gains, I think your metabolic flexibility is much better now. So that means you can probably have a lot more leeway to go back and forth, add a little bit more carbs, and just see how you do, especially for people going into menopause, or for the thyroid issues, or even for what's going to be happening to your ovaries going in retirement. You might need might support the adrenals a little bit more. So again, that's my long answer for an experimentation to try it out and see how you do. But there is going to be something we are going to create within a couple more months to be able to answer questions like this, because they're theories that we want to test them out. So we'll be able to figure this out probably the next year.
Thanks so much.
Sure. Thanks for a great call, and good luck with all that. Okay, and drberg.com for answers to so many things. Let's now go to answering quiz question number 1, which you guys jumped on to help us catch up. And it asked, what is the most commonly prescribed and abused drug used by patients that are prescribed by dermatologists? And 72% of our respondents say it's Accutane. 20% say it's steroids, and 8% say it's Botox. Doc, any winners?
Yes, we do. It's topical steroids. That's like the most common thing that they give you when you go to a dermatologist, yet it's the thing that's mostly abused, because here's the problem. When you put steroids on your face, I'm not talking about the rest of your body, but on your face, it can there's some serious bad effects, because you end up so-called curing the condition, but then it actually induces and creates the same condition. So there's like steroid-induced dermatitis, there's steroid-induced rosacea, there's steroid-induced all sorts of problems, because steroids actually take away the immune system of they lower the white blood cells. So you can imagine now you get decreased inflammation, maybe more pathogens can come. You might create withdrawal syndromes where your cells, like, all of a sudden you need it more because it's like it created a bad effect. Also, it's going to stop the collagen from growing, so you're going to end up with really thin skin that has these little spider veins and things. So be very careful with those topical steroids. I would not even, personally, this is just me, I wouldn't use them. I would try something more natural, which I think we'll get to in the next question.
Speaking of the devil, there you go, Doc. Number 2.
What is an effective and natural way to help repair something called topical steroid damaged face, which is like red face from the side effects from these topical steroids?
All right, audience, climb on that. All right, let's see. Gabrielle from Rumble. Are herbal tinctures made with alcohol, did I say that right, keto-friendly or harmful to the liver?
Well, there's two types. Yeah, you have the water extracted, and then they have alcohol solvents that are helping break them down. Some people can tolerate. I don't like them. If you do have them, they're very kind of small amounts because they're using alcohol to really pull these things right out. So sometimes you're not going to get as concentrated phytonutrients unless you use them. I don't like the idea because I'm really sensitive to alcohol. So I'll do the non-alcohol one. But some people, they do fine. They can tolerate a little bit of alcohol because we're dealing with this very, very tiny amount.
Okay, Makani 3 from Rumble. How often should we make a new batch of Reuteri yogurt? Does it have a shelf life?
Yeah, it does. A couple weeks because it's live. And when you put it in the fridge, which you need to, you actually stop the growth of it. You already got a huge growth, but then it's going to start to break down. And so those microbes, this is why, like I do, make enough so it can last you like maybe a week and a half to 2 weeks, and then you just keep making more. This is what we do. And you'll keep it going. And it doesn't have a long shelf life. Like a lot of these yogurt that you buy, oh my gosh, by the time you eat it, like you'd be lucky if there's any microbes left.
All right, very good. Let's go to Karen from YouTube. I've been diagnosed with H. pylori. What's the best way to naturally treat it? Do I need antibiotics?
I can't tell you not to take it, but I'm going to give you some ideas on, Steve, this happens every single show. I'm about to answer that question. So I'm not going to say anything. Just stay tuned. We will get to that question. And somehow someone's feeding them the questions, or they're super intelligent and can actually have telepathy.
We have a mole. Okay, let's go find out, in addition to the mole, who's listening to us today. So we'd like to say good day to all of our viewers joining us from the UK, Canada, Mexico, Romania, Indonesia, Finland, Spain, Japan, Armenia, the Czech Republic, Austria, Norway, South Africa, Poland, Ukraine, Panama, India, France, Scotland, Ethiopia, Italy, Greece, the Netherlands, the Philippines, Brunei, American Samoa, Chile, Ghana, Sweden, Germany, Trinidad and Tobago, Vietnam, Turkey, Brazil, the Virgin Islands, Iran, Slovakia, Ireland, Pakistan, Nepal, Colombia, Oman, Eritrea, Switzerland, Venezuela, Sri Lanka, Cameroon, Malta, Jordan, Ecuador, and all across these United States. Thanks so much, everybody, for tuning in. And let's see, let's go to answering quiz question number 2. Let me bring that up for the audience who quickly answered it. And it asks, what is an effective and natural way to help repair topical steroid damage in the face, TSDF? And 85 of our respondents say it's castor oil. 10% say it's zinc ointments, and 5% say good old vitamin D.
All 3 are correct, but the one I was looking for would be infrared. Again, you'd have to get the right light for that, but infrared is super healthy for your skin. But I will say too, I would try to heal it from the inside out with zinc, omega-3 fatty acids and things like that, because these steroids, I had poison ivy every single year for like 10 years, and I used the steroids, and then as time went on, they stopped working, and then it got worse and worse, and you're like, wow. Then what do? You take stronger and stronger steroids, and then you get the side effects. So I'm the poster child for taking too many steroids, and it's some serious side effects.
Ouch. Koo Mud from YouTube, what's the best remedy for osteoarthritis? I really appreciate your advice as my quality of life has diminished. Sorry to hear that, Koo Mud.
So go low carb and do intermittent fasting. Both of those are anti-inflammatory. Of course, omega-3 is going to be important as well, and get rid of the seed oils. But I think you're going to need a lot of stretching, and especially the fascial stretching. Look that up. Constant motion, because that's what the arthritis kind of keeps you stiff. I'm going to be releasing more of a video on that relates to another remedy, which also is good for osteoarthritis, which is tutka, because they found there's bile salt receptors in your cartilage, which is like, what are they doing there? So there's a whole relationship between another function of bile that goes beyond just the digestion of fats.
All right, let's go to A11, as she's calling herself from YouTube. Could too much coffee, 6 cups a day, contribute to fibroids in the breast? Would vitamin E and omega-3s help reduce them?
I don't know, but that's a little bit too much coffee. And also make sure you're doing organic coffee, and obviously have less. But the big thing with the cysts in the breast is the estrogen dominant situation. And one of the best remedies for fibrocystic breast is the iodine, sea kelp. Just it clears it up really quick, because iodine helps regulate the excess amount of estrogen.
Wow, good luck with that. Alina from YouTube, starting a 5-day fast today. Can I substitute bone broth for water?
I think you should. Only have the bone broth if you really, really need it, if you're really, really tired and weak. But try to just do water, and of course the vitamins and sea salt.
All right, Andrew from YouTube, how can we be sure that products like protein powders aren't contaminated with lead?
This is a good question, because people think, oh, I should go with the mainstream brands, which don't really have a face behind them. You don't really know who's really behind them, these big companies. Find a company that is controlled, that actually that you can trust, someone that actually really gives a crap about these ingredients, and that works hard to make sure that they make them clean, versus someone else that you don't really know who's behind the brand. There's a lot of marketers that buy stuff just from China. I'm in this industry, I know, and it's like, even when I even bring up to our manufacturing company, okay, I want this product without maltodextrin. They go, what? You're the first person to ask me that. Well, that's going to cost extra. I said, I don't care. So a lot of companies go for the cheap ingredients, and they don't really look at the quality, and you'll never know that. So you got heavy metals, and you get all these other stuff. So just find someone that you can trust that actually produces products, and maybe that might be the best option right now.
Absolutely. Let's go to quiz question number 3, maybe the mysterious one.
True or false? ADHD isn't really an attention deficit disorder.
Okay, true or false, audience?
We forgot the N on that, so you'll have to blame that on Terry.
Oh, good. I love doing that. Okay, let's go back to social media. Mrs. J from YouTube, how can I naturally lower my cholesterol levels?
Eat less refined sugar and starch and carbohydrates. That's going to be your best bet with that, because excess carbs will turn into more cholesterol and triglycerides.
All right, good luck with that. Linda from YouTube, are there specific supplements to help prevent cataracts?
Yeah, there are. There's even a drop. It's called N-acetylcarnosine drops. It's a powerful antioxidant, and it's really good to even reverse cataracts. And of course, when you're outside in the sun, there are certain, you have to be careful about having especially when you get older and you're more prone to cataracts. You may need a good, like a blue blocker or something, because some of that sun could be kind of harsh to your delicate lens. And and then of course the seed oils, just avoid those, eat healthy. The junk food creates what's called advanced glycation end products, which actually end up destroying your proteins, which the lens is. And so you got to really clean up the diet and have a lot of foods that have antioxidants. And even grass-fed, grass-finished meat it's loaded with plant-based antioxidants, believe it or not. So it's not just plants, but I think like sauerkraut has great polyphenols, and you can do that, and healthy tomatoes, and all these things can actually contribute.
All right, very good. Let's go to our next guest, Linda from North Branch, Minnesota. Go ahead with your one question for Dr. Berg, Linda.
Hi, Dr. Berg. I intermittent fast for 18 hours per day. I use your multi-collagen peptides with 8 ounces of water at the 12th hour. So I need to know, does that break my fast? And can I intermittent fast indefinitely?
Yeah, it does break your fast. You might want to do the fast. You might want to take those collagen, those peptides right after the fast, even to help break your fast. And that way you don't add any protein, because you are adding amino acids to that mix. So yeah, collagen will definitely break it. And then the second question is, can you take it for a long period of time? Yes. Because you're just supplying amino acids. It's like your body needs it, and 30% of all of our protein are collagen. And unless you're consuming that from in your diet, sometimes it's helpful to get it as a supplement. Most people like the tender steak and meat. They don't like the tough fibrous, which that's all the collagen. So, and you probably, I don't know, some people for some reason, like Steve especially, don't like to eat the cartilage from the chicken bones or chew on a bone. So in which case, then you probably need to substitute.
I don't know what's wrong with me. Okay, thanks so much, Linda, for a great question. Let's have Linda and everyone else look at quiz question number 3 and answer it. And it asks, true, false, ADHD isn't really a attention deficit disorder. And 55% of respondents say that that's true. 45% disagree with the 55% and say it's false.
ADHD, and just I'm just going to just say this. I think that I don't even like labeling people, put them in a box with some mental illness, because then now you have a drug treatment. I'm very much against that. But let's just say you have some of the symptoms of this, which I'm always going to give you a natural solution. What this problem really is, more than an attention problem, it's a executive function problem where you know what to do, but you just don't do it. And a lot of that can be improved from taking the right nutrients, omega-3 fatty acids, which actually helps the brain, and the executive function of the cerebral cortex. Zinc is going to be really, really important. Vitamin D and magnesium is going to be super important. Getting enough sleep will be crucial, and going on a low-carb diet. All those things can greatly help that condition. And some people also need to do more, get more help from their environment. Like it's with exercise, get a coach that can push you through it, or do more to-do list, or put things on the calendar, or have like a timing thing to remind you to do these things that you're trying to do. So the problem when you take a drug for this is that, yeah, it might work initially to help you stimulate the brain, to manipulate the brain, but it comes with a package, a serious package of side effects that happen down the road. That then what? Are you going to keep taking the drug? It's not a long-term good solution. And I know personally quite a few people who've gone down that pathway, and it's a trap, because now they can't just come off. They have to very gradually taper off, and it's a nightmare. And it's also a nightmare of how many problems it can create for you. And if anyone tells you it's safe long-term, have them show you the evidence of that. They won't be able to. It's not a long-term solution, or from my viewpoint, it's not even a short-term solution.
All right, very good. Well, Michael from Manchester, we have you queued up. But first, let's ask quiz question number 4, then we'll go to Michael.
Okay, true or false? The pH of your skin should be slightly alkaline.
All right, folks. That's a true falser. And it's true that we have Michael on. Michael, go ahead with your one question for Dr. Berg, please.
Hi, Dr. Berg. Yeah, so I'm 46 years old and I don't sleep well. I don't feel like I get a good restful sleep. I wake up to go to the bathroom a couple of times. You got any tips for me on how I can improve my quality of sleep?
Absolutely. If we're dealing with, if what wakes you up is the bladder situation, the simple solution would be to really focus in on that insulin resistance. So cut out the snacking at night. Not that you snack, but if you do, cut out the snacking at night and in between the meals, and maybe have 2 meals only, go low carb. That will greatly help your urine situation, and then that could solve your problem. The other thing that I would recommend is in the morning. This is super important. Get outside, get some sun. If there is no sun outside, have one of those full spectrum lights in the morning, at least 20 minutes. That'll start to set the circadian clock, believe it or not, at night. And then at night, about 2 hours before bed, start dimming things down. Try not to expose yourself with too much, especially blue light. And then start resetting the circadian rhythm, because what we want to do is have you align your biology and your DNA with these certain patterns and to get that deep sleep cycle. I have a lot of videos on this. I had a sleep problem really bad. So there's a whole protocol. You can watch some of the videos, but at least those would be some good tips.
Michael, thanks so much. Great call. Appreciate you coming on with us. And let's see, let's go to Judy from YouTube. My mother has been diagnosed with bile duct cancer. Sorry. What causes this and what's the best way to treat it?
I think obviously it's probably related to something negative, something some type of bad food that, in your diet that over time has created a problem. I don't have all the details. I don't know. But since you have cancer, you should watch my recent video on cancer. I'm not going to have any claims on that, but I think it's a very logical way of presenting a diet that's tailor-made for your specific type of cancer. You can download it, you can look at it, because here's the problem when you go to the doc. If you ask them, well, what should I eat? They're going to say it doesn't matter. Really? It doesn't matter? No, it does matter. So at least get on the right eating plan with whatever treatment you're going to do. And this may potentially benefit you. So take a look at that video.
All right, very good. Barry from YouTube, what's the best way to treat saggy and moldy eyelids? Goodness.
Well, I would look at the lifestyle factors. I would look at your sleep cycles, your food. Are you getting enough sunlight? Do you have any bad habits? Start implementing these key factors with lifestyle habits, and implement those more than anything before you start doing anything else. That's what I would recommend.
All right, very good. Let's answer quiz question number 4, and it asked of the audience, true, false. The pH of skin should be slightly alkaline. 65% of respondents say it's true, and 35% say that that's not true.
It's false. The pH of your skin is actually pretty acidic. It's between 4.5 and 5.5. That's acidic, because neutral is 7. So if you go from a 7 to a 6, that's 10 times more acidic. We're dealing with 4.5 to 5.5. So that's pretty acidic. And this is why baking soda on your skin is not a good idea. There's a lot of videos I have on this that you can help acidify the skin gingerly, not putting acid on it, but just maybe a diluted acid that will provide enough health to the skin that will change the environment of the skin. So now the microbes on the skin can have a chance to thrive. And I know you're probably feeling grossed out about that, but without those microbes, your skin's going to be red, oily, dry, flaky, and acne. So you want to support the microbiome on your face.
Okay, sorry, folks, having a little technical issue here as I get Dr. Berg back up. I don't know what happened there, and there you are, Dr. Berg. Okay, let's see. Let's go to the final quiz question of the day. If I can get that to come up, and there you go, Doc.
Okay, out of all the unique remedies cabbage juice can give you, what would be at that very tip of the list, or the top of the list?
All right, audience, climb on that. And let's go back to our social media folks. Vita Baltic from YouTube. Should I take apple cider vinegar if I have birch allergy and cross-reactive allergy to apples? That's interesting.
I don't know. Test it out. See how you do. It's one of those things that you'll know real quick if you have a problem with it or if it helps you.
All right, very good. Let's go to Syed from YouTube. What are the key steps in reversing type 2 diabetes?
Reduce your amount of refined carbohydrates in the form of sugar and industrial starches. Okay. Go on low carb. That's the most important thing you can do. The second most important thing you do is to not snack anymore. So just have 2 meals a day. And if you did that, you could actually reverse, not put it in remission, reverse your diabetes. There's studies on that within 10 weeks.
All right, very good. Let's see. Mom of 3 hunters, at a girl from Rumble. What are your thoughts about inhaling hydrogen peroxide for the flu? Many sources say it's dangerous, but others say it's effective.
Yeah, I don't. You got to be careful with that. It's a very highly reactive thing. I'm not going to recommend it because that's one of the things that they're going to take this video down. So inhaling hydrogen peroxide, it's a very corrosive thing. You don't want it on your face. So when you put it in the lungs, you got to be very, very careful and cautious. So I'm going to just omit answering that question and move on to the next question. So keep myself out of trouble.
I think that's wise. AT Technology from YouTube. I do get rid of a yeast infection as well as Lyme disease. It didn't say how. I think it's how do I get rid of a yeast infection as well as Lyme disease? Also, what would help with arthritis in one knee? She's got a lot of problems.
There's a whole protocol on Lyme, but for the fungus, you want to just starve it. And usually you cut down the refined sugars and just basically starve it of fuel because they go after this highly refined sugar in milk sugar. They just love it. So you just starve them to death. With the Lyme, there's a whole protocol on that. You can look that up. It's going to take a long time to kind of go through that. And then the third question related to what?
Oh dear, I erased it, so I wouldn't ask it again. Forgive me.
Okay.
All right, but let's go on to Debbie from YouTube. What's the best red light delivery option, panel, bag, or mat? Got any suggestions?
They all tend to work pretty good. I don't have a better one, but I like the red light therapy. And I'm just going to let those people know that are out there, you don't actually need to buy any red light because the sun gives you a tremendous amount of red light, especially right around noon. So, and even when it's sunrise and sunset. So if you get more sun, you will get red light. And the way that you know you're getting it is the warmth of the sun. That means you're getting the red light. So that being said, get more sun. It's actually pretty affordable too, Steve.
Oh, good. Well, it certainly is.
Almost as affordable as fasting.
Oh, no kidding. Unless it's cloudy. Channel 4 Lynn from Rumble. Can someone improve their liver health with your gallbladder formula, or is Tutka a more efficient choice?
What I'm going to say is both of those formulas can help support a healthy liver because anytime you're talking about products, that's pretty much as far as you can go with that. And then you can look up more what it does specifically.
All right, I think this is a good question. Super Stafford from YouTube. I clench my teeth at night. How am I supposed to wear a bite guard without ingesting microplastics? They're all made of plastic.
That's an excellent question. I think I would try to find one made out of some other material, or not use them, or take more B1. Take more B1. That might just help you. Steve, did we answer all the questions?
No, we got one more, and here it is, and I've got the answer for it. Of all the unique remedies cabbage juice can give you, what would be at the top of the list? And 70% of our respondents say it's improved gut health, 20% say it's reduced fat in the liver, and 10% say it's ulcer and digestive healing. Are they smart today?
Cabbage juice has this very unique vitamin U, and chemical name is S-methylmethionine, which actually can repair tissues, and it's very specific to help repairing ulcers, okay? Ulcers. That's why cabbage juice is used long ago. But cabbage also has sulforaphane, which literally drives the H. pylori back into remission, which is usually responsible for most ulcers. If you had an ulcer from an NSAID, then this would also be a good remedy. So this cabbage is just a fascinating thing, but you just need to drink the juice of it. And even when you ferment it, you enhance those factors for an ulcer. On that note, have a wonderful weekend, and we will see you next week, same time, and we'll correct these technical difficulties.